Sir was the highest scorer in Ashtanga in first BMS. Sir was awarded as Rasavisharada in the year 2008. Sir has specialized practice in the field of Mansaroga, Vatavyadi, and Mutrashmari. He is presently working as associate professor in the Department of Kaya Chikitsa in SS Sindagi Shantavireshwara Ayurveda Medical College and Hospital, Haveri. Sir was a resource personnel for Vrka Ayu 2021 on behalf of Silver Jubilee celebration of RGHS Bangalore, organized by DGM Ayurvedic Medical College Hospital and Research Center, Gadag. Sir has presented 24 papers in national and international seminars. Sir was a resource person for CME on clinical practice of Rasayana, clinical practice of Ayurveda Manasaroga, and many more. He has published 6 articles in national and international journals. He has peer-reviewed 5 journals and reviewed 36 articles till date. He is a peer reviewer of Journal of Pharmaceutical Research International. He was a resource person for national and international webinar organized by different institutions across India. Sir is also a motivational health speaker and he has given talks all over India. He has given a radio talk in Namura Banuli. He has worked as a judge for national and international conference and poster competition. Sir has nine and a half years of teaching and clinical experience, and he was the resource person for transitional curriculum for UG and PG. He has treated more than 230 Mutrashmari and Gridrasi cases without surgery, and even they are which were advised for surgery. He has specialized practice in Ayurveda Rasayana and has treated more than 1,040 patients. He has treated more than 320 Mansaroga patients. On this platform, welcome. We wholeheartedly welcome Siddanagouda sir for today's talk. Over to you, sir. Sir, you are not audible, sir.
Now I am audible.
Yes, sir. Yes, sir.
Thanks to the Ayurdrishti team for inviting me as the resource person for this webinar. My slides are visible.
Not yet, sir.
No. No. Slides are visible also.
Yes, sir.
Good evening, everyone gathered here. My special thanks to the organizers for this wonderful organization. Without taking much time, I move on to my presentation. Utility of Rasayana in clinical practice. This whole presentation is dedicated to my teacher, late Dr. G. Srinivas Acharya sir. Without his guidance, it's very difficult to practice Rasayana for me. Under his guidance, I am able to practice few of the Rasayana treatment modalities in the clinical practice. Before going to the proper Rasayana, the approach, we should think of some of the questions related to the practice of Rasayana. Why one should practice the Rasayana and challenge during the practice of the Rasayana medications and disease specific Rasayana, how to prescribe Rasayana for healthy. Okay, in my special perspective of the Rasayana practice, the Rasayana is constituted one among the special branch which is mentioned in Ayurveda, which mainly deals about the Vayastapana. Okay, we all consider that the Rasayana is constituted the rejuvenation treatment, but Rasayana is not only a rejuvenation. Beyond the rejuvenation, it is constituted Vayastapana and even the Jaraharana and even the person who is having the Vardhakya, even some attainment of the Rasayana, the Palashrutis like the Smriti, Meda, Arogya, and the Taruna Vaya. These are the three mottos are the main outcome of the Rasayana practice. And many challenges we come across the Rasayana practice. The main challenge will be the duration of the Rasayana and many the Purva karmas related to the Rasayana procedures. And the selection of the disease specific Rasayana is also very important part of the Rasayana practice. And how to prescribe the Rasayana for the healthy the individuals. Definitely, Rasayana is one such treatment modality which is indicated in both the Swastha as well as the Atura. Even definitely we can go for the selection of the different Rasayana Aushadhis in a healthy individuals also. And next, why to practice Rasayana? Okay, already I told if you go with the literature from Charaka, Chikitsa first chapter, especially before starting the Rasayana Upakramas and the explanation related to the Rasayana. He says the word, the Mahabalam, the Rasayana is comes to be an one such treatment modality which is having the different effects in a different systems. It may be a multi-systemic benefits or Rasayana can be advised in a healthy individuals. Rasayana can start from birth to the till the Ruddha individuals, and Rasayana can be practiced in the Bala also. And many times, and most of us are came to know about the many modalities related to the Rasayana practice during COVID-19. The best immunomodulator as the outcome of the Rasayana, the practice. And if you see the particular the definition related to the Rasayana from the Chakrapani's understanding, that is Rasasya Ayanam Rasayanam. The Rasayana is one which starts its action from Rasa to the other dhatus and which is helpful for maintaining the Rasadi dhatus and its the proper the nutrition. That is also the one more the added benefit of the Rasayana Aushadhis. That's why one should focus on the practice of the Rasayana medications and the Rasayana speciality of the clinics. And challenges during the Rasayana, so whatever the challenges we have in the particular the practice that I am going to focus, the Shodhana is needed or not. Text says definitely if you see the first the Abhayamalaki pada of the Rasayana, Charaka says the Rasayana is mandatory for the practice of the Rasayana. But in routine clinical practice, it is very difficult to go with the all the shodhanas which are mentioned before starting the Rasayana practice. That's why we can modulate and we can go with the analysis of our yukti based on the patient condition. And many times nowadays the patient who comes to us, they come in a end stage of their disease, or many times they won't get the particular the holidays for their treatment, and we need to modulate ourselves as a many the factors. For that, so at least you go for the one sitting of the Nitya Shodhana or the Asadhya Shodhana, because we have the different practice of the Rasayana and you can get according to that particular Shodhana practice and the Apurma karmas as their desired effect. That's why it's not a mandatory to go with practice of all the patients for Rasayana Shodhana as the Apurva karma. According to your need, definitely you need to modulate at least the one Sadhya Shodhana, then go for the prescription of the Rasayana medications. And while practice of the Rasayana Aushadhis, we have different methods. The one is the Kuti Praveshika and Vata Tipika. The Kuti Praveshika Rasayana is the one special modality. In this patient, the particularly has to follow the particular rules and regulations which are prescribed under the Rasayana, the treatment. But it is very difficult again many times. If patient is willing for the Kuti Praveshika Rasayana, if they have time to spend on that particular treatment for the hospitalized treatment, definitely we can practice that. But many times better to go for the practice of Vata Tapika Rasayana. It doesn't even affect the routine of their patients. And many too many factors we need to consider while prescribing the Rasayana Aushadhis. The common factor includes the Vaya. Okay, many times it is very difficult to go with the classical dosage of the Rasayana medications. It may be related to the Vaya, especially the Bala. It is very difficult to plan all the therapeutic dosage which is explained in their classics. And some of the Rasayanas which are causing the problem to some of the individuals. Best examples, the person who is belongs to the Pitta Prakriti. If you want to prescribe the rasayanas like the Ballataka and even the rasayanas like the Lashuna or any Tikshna or the Ushna, the rasayanas, definitely the Prakriti plays a very important role. There you need to follow some of the guidelines to prescribe those the rasayana medications. And Agni, the best example it starts from the Charaka, the Tiksasana first chapter itself. The best example we can quote the Chavanaprasha Leha. The person who is having the Pradipta Agni or the proper functioning of the Jatra Agni, then many of the rasayanas, Aushadis are useful in the practice. That's why you need to consider the Agni Bala of the patient before prescribing the Rasayana Aushadis. Many times, patient may be because of underlying disease condition, they may be having the state of Mandagni or the Vishamagni. First, try to correct that the status of the Agni, then go for the proper the Rasayana Aushadis and even dosage. Dosage also plays a very important role in my the particular practice of Rasayana Aushadis based on the particular clinical condition, divide into the Rasayana in terms of the Pravara Matra, Madhyama Matra, and Avara Matra. For that, you need to analyze the Samprapti of the patient, Deha Bala of the patient, and Agni of the patient. If patient is having the Prabala Agni Bala and Prabala Bala, Deha Bala, then it is easy to plan for the classical dosage of the Rasayana. For the special practice of the Rasayana, you should always concentrate on the classical dosage of the Rasayana Aushadis. If you give the classical method of that particular Rasayana Aushadis and dosage according to that, which is mentioned in the classics, then only it gives the desired the outcome. Otherwise, you may get the the outcome, whatever the outcome it will be, a minimal or sometimes we can't achieve that much the results in our patient. And duration, we have the specific duration for each and every Rasayana. For example, you take an example of the particular Arogyavardhini. Most of us are using the Arogyavardhini Vati in the practice of Kushtaroga or many other the clinical condition. If you want to prove the Rasayana effect of the Arogyavardhini, the Rasa should always administer that particular the medicine in a particular dosage and at least for a period of one mandala. Then only will get the particular the results. Otherwise, many times you won't get the particular the outcome by that particular measure. And definitely the indication. Sometimes the person may indicate it for their prescription of particular rasayana. Sometimes it is very difficulty to plan with the rasayana medications. Best example, usually I quote the practice of the Lashuna Rasayana. It is commonly contraindicated in a patients who are having the rasa as well as sorry the rakta as well as the pitta avarana. Definitely you need to consider the indications for the particular rasayana. Each and every rasayanas are having the specific indications and the contraindications and even general contraindications are also mentioned in the classics. That also you need to follow. And next will be according to the particular rasayana prescription, you need to follow the patya and the apatya which is mentioned in the particular context. And just a revision from the classics, the rasayana always rasadi dhatunam apayanam. Already I told the rasayana is one such treatment modality which starts from action the rasadi dhatus and it is mainly the based on the rasa virya vipaka and the prabhava of the many of the drugs. And the Sushruta understands the Rasayana Tantram Vayastapanam. The word Vayastapana refers to the Ayusho Vardhanam or the Shatayu Prabham. That is the word which is mentioned. Not only that, we may get other desired outcome like the Meda, Bala and Rogaharana. There will be two varieties of the Rasayanas which are mentioned. The one will be the based on the particular action of the Rasayana Aushadis and one will be particular the outcome which is mentioned from the Rasayana administration and the methods of administration. These are the different methodology which is used for the Rasayana, the classification. In this context, the Vayastapana refers to the Jarapaharanam. That's why I already told the Rasayana is not only the immunomodulator, Rasayana is having multifactorial benefits and the effects. The one is Ayushkaram. It gives the particular Ayu to the individuals. Shatadikam Karoti. It gives the long years of the healthy life to the individuals. And many times nowadays, the present practice of Rasayana, the aging, early aging, the many individuals come across the Vali Palita, Kalita and problem related to the early aging. Definitely, if you want to well versed in Rasayana practice, if you observe the particular the outcome of the Rasayana medication, the one outcome will be Jarapaharanam. It delays the definitely the aging of the individuals and Bahukalam, the Tarunam Bahukalam Stapaiti, that many times we can achieve the Taruna Avastha by prescription of different Rasayanas and Rasayana, the Kuti Praveshika and Vata Tapika. And next will be the other varieties like Kamya Rasayana, Naimittika and Ajashrika. The particular Icha, the Kamya Rasayanas are taken for the particular Icha or their desires. Definitely some may be administered for the Prana or the Medha Kama. It's also helpful in many of the clinical conditions. And my the motto is to discuss about the Naimittika Rasayana. The Naimittika Rasayana is one is indicated for Vadi, the Nashana or the Vadi Shamana. And Ajashrika Rasayanas are the Rasayanas which are used every day as a in terms of their food. The best example is Kshira Gruta Bhasanam. The one example he quoted Naimittikam Vyadi Nimittam. It is particularly prescribed for the Vyadi Harana. The example is the Shilajatu, Pallataka and Tuvaraka Rasayanas. And the other varieties will be the Shodhana and the Shamana Rasayanas. The Shamana Rasayanas will be in terms of the Naga, Baladi, Prayogamiti. And based on the particular categories or the Veda, the Rasayanas are Vata Tapika, Kuti Praveshika, Achara Rasayanas, Kamya Rasayana, Naimitika Rasayana, Aushadha Rupi Rasayanas, and the Ajastrika Rasayanas. Okay, already I was telling the Shodhana is mandatory or not. If patient is willing for the Shodhana or the fit for Shodhana or patient have the at particular the duration of time with them or the hospitalized willingness for the Rasayana, definitely we can go for the Shodhana. Then only we can go for the particular the Rasayana Aushadis. And Rasayana can start via Prakriti Sadmithyam. After knowing the via and Prakriti and Satmeta to prescribe about some of the Rasayana medications. The Satmya concept is also very important. Best example, the the Rasayanas which are having the Mamsa Rasa as the main ingredient. Particularly, that particular Rasayanas are not Satmya to their particular the individuals. Like the Ajamamsa Rasayana is not the Satmya to the all the individuals who are Satmya to the Mamsa. Then for them only it is possible to administer. To take care about such things, definitely we need to consider the Satmya in individuals. And next we have the common contraindication for the practice of the Rasayana, purely the Sapta Purusha. Most of you know that is Anatmavan, the person who is not having the faith, and the Alasya and Daridra, Pramadi and Vesani, the Papa Kruta. Okay, they are not fit for any of the Rasayana, the prescription. It's a common contraindication which is mentioned. So when to start the Rasayana medications, particular Rasayana Aushadhi has to be started from via Prakriti Satma is the first thing you need to consider. And Rasayana is indicated in all the individuals from birth to the till the Ruddha Avastha. For Bala, we have the practice of Lehana. Lehana is also considered the best method of the practice in the Rasayanas. Here we have other the Rasayana Aushadhis for Bala. So what I am discussing is purely belongs to the Madhyama and the Derudha, the category of practice of the Rasayana. And if you want to achieve more in the practice of Rasayana or proper the methodology to follow in the practice of Rasayana, first you should know about what are the indications which are mentioned in the classics according to the particular Rasayanas and how to administer the particular Rasayana medications and what is the dosage which is mentioned in the classics and the duration of the Rasayana Aushadhis and the Patya and the Apatya which has to be followed in particular Rasayana Aushadhis. That all of you keep in mind. If you prescribe the only Rasayana, it's not an enough. You should all these things you should know well manner. Then only it is easy to popularize in the practice of the Rasayana. And today I am going to highlight few of the Rasayanas which are routinely used in my clinical practice. The one is Chavanaprasha, the Rasayana or the Bhargava Prokta Rasayana, Vardhamana, Pippali Rasayana, Guru Rasayana, that is nothing but the Shilajatu, Loha Rasayana, Balamula Rasayana, Guduchi Rasayana, Estimadu Rasayana, Lashuna Rasayana, and Nidya Rasayana. Apart from the Chavanaprasha or the Bhargava Prokta Rasayana, all the Rasayanas, the Vardhamana, Pippali, Guru Rasayana, Balamula, Guduchi, Estimadu, Lashuna, and Medya, all are available in the form of the capsule, which is prepared by the STM Ayurveda Pharmacy Udupi. And if you want to plan the rasayana, you should know what is the particular drug which is available, the form of the drug. So what I am using, all these are in a cellulose capsule form, which is prepared by the STM. All are the vegetarian or the vegan capsules, which are made from the fiber of the plant, and like the gelatin. The resulting capsules are tasteless and odorless and even colorless, because many times the palatability also matters while prescribing the Rasayana medication. That's why it is easy to go with the classical dosage of the Rasayana medications if you are using the capsule form. Many times we used to feel difficulty to take some of the medications. That's why the nowadays the pharmacy is well advanced. We can make the modulations according to your need. The earlier days, the Lashana Rasana is best prescribed by using the pulp of the Lashana, which is kept at overnight in either the takra or the kshira. But nowadays, definitely the capsules of the Lashana Rasayanas are available. Definitely we can use those capsules because it doesn't produce much of the discomfort to the patient, and definitely they can engulf and they can take the classical dosage of the medications. That's why we need to modulate and we need to well advance in the practice of rasayana by available the form of the particular the rasayana aushadis, and some we can't modulate, but some we can modulate definitely. And first will be the Bhargava Prokta or Chavanaprasha Leha. Okay, this is a very popular duck. Most of you know, and it is commonly used by many of the persons, and it is available in the routine market and every the medical shop. But the Chavanaprasha is also sold under the umbrella of the Bhargava Prokta Rasayana. This particular word which is used in the Vatavadi chapter. The Palashruti of this particular Chavanaprasha Leha will be Kshinakshatanam Ruddhanam Balanam cha Angavardhanam Swarakshay Mururogam Rudrogam Vatashwanitam. Chavanaprasha is one such drug which is having the mainly amalaki as the main ingredient, and it can be used in many clinical conditions. And already many of you experienced the outcome of this particular Bhargava Prokta Rasayana. And here you try to understand Kshina Kshatanam, the person who is suffering with the Kshina Dhatu Avastha. It may be any clinical conditions. Most of the chronic disorders or the Purana Vadis, or most of the categories of the Asadhya Vadis, they are almost have the Kshina Dhatu Avastha. Definitely you need to assess, is there any Kshina Dhatu Avastha in a patient, irrespective of the particular the Shrotas. Definitely it is one such prescription. It can be used in many of the clinical conditions where you identify the Kshina Dhatu Avastha and Ruddhanam. Definitely this particular Rasayana is indicated in all the age group. Okay, and most of us routinely consume this particular the medication without the prescription of the doctor. Okay, and next will be Balanam Changavardhanam. Here we can definitely make out the bala is already having the akshina bala mamsa. To go with the proper the growth and the development, sometimes the individuals or the children or the bala who is suffering with any of the problem related to the angavardhana or the milestone. Definitely we can prescribe the Bhargava Prokta Rasayana. Swarakshayam Urorogam. Definitely it is indicated in many other the prana or shroto vikara, the Swarakshaya, Uroroga, Rudroga, Vatashonita, Swasa Kasa. Okay, definitely you can make a gist of the practice of the Chavanaprasha Leha. It starts from the Rasa Dhatu till even Asti Majja, okay, where there is an involvement of this particular the Vadi. Definitely we can go with this particular Rasayana medication. Routinely I used to use this particular rasayana in many the clinical condition where dhatuksha is identified, karsha, bala, ruddha, and swasa. The administration of this particular rasayana is the orally is available in the form of the leha, 15 to 20 grams of the chavanaprasha leha once or twice in a day, at least for a period of 1 month, and the patya will be the kshira. Okay, definitely if you follow this, definitely will get the desired outcome. Okay, here I have one case related to the prescription of the Vardhamana Pippali Rasayana and the combination of Bhargava Prokta Rasayana. The Pippali, the Vardhamana Pippali again from the Charaka, the Chikitsa, the Rasayana, Rogadikara, okay, where the Palashruti of this particular, the Pippali Rasayana, again it is available in the cellulose, the capsule. Okay, here we can indicate the Rasayana in the Swasa, Kasa, Pinasa, Vatarakta, Amavata, and the Arbuda. The dosage pattern of this particular Rasayana, if you want to get the desired results which are mentioned as in the classics, you can go with the proper methodology which is mentioned in the classics. The first day you start the Rasayana as a 2 capsule, second day go for the 4 capsule, third day you can go for the 6 capsule, and up to the 10 days, every day you need to increase the 2 capsules per day. On 10th day, the 20th capsule. Again, reverse the order of the particular Rasayana, and this Rasayana is prescribed for the duration of 19 days, and the Patya will be Kshira and the Sestika Shali, because many times the Pitya, the Vardhamana, the Pippali may produce the Daha, the Karapada Daha and the Uro, the Daha in a patient. The best, the Patya will be Kshira, Shastika Shali, and better to avoid the Ushna Tikshna Aharas and even Amla Dravas during the prescription of Pippali, the Rasayana. Okay, here I had a boy of aged about 12 years, not a known case of diabetes and hypertension was apparently normal. 6 months back, he started developing the repeated episodes of the sneezing, running nose, which is associated with the cough. Okay, he was taken many of the medications related to the particular, the contemporary, the science. Later he consulted to our hospital, just planned the 2 Rasayana Aushadis. Okay, one is the Chavana Prashaleha, that is 2 teaspoon early morning empty stomach, and next was the Vardhamana Pippali Rasayana. Okay, why the dosage modulation is made here? Here the age of the patient was 12 years. Okay, according to that, you need to adjust the dosage. Okay, here it is very difficult to plan the layer dosage are that of the classics like the 48 or 50 grams. We can maximum plan about 5 to 10 grams in a patient. And the Pippali, again the Ushna Tikshna Dravya, always better to avoid the Ushna Tikshna Dravyas in the Bala and the Ruddha. Always go for the Shamana dosage form of the Rasayana. Okay, here the Shamana dosage of the Rasayana which is followed. The patient prescribed this particular medication for the 1 month. He was all right. Just for the further the follow-up, only the 1 teaspoon of Chavanaprasha and the OD dosage of the Pippali Rasayana was the planned in a patient. Almost the symptoms were reduced in a span of 1.5 months, and till now there is no reoccurrence of any of these symptoms. Okay, he is the patient from our area and he was residing in Bangalore. Okay. The next is the Guru Rasayana. Okay, the Guru Rasayana is just the version of the Shilajatu, the Loha Rasayana. If you scan the literature, especially from Charaka, third Rasayana Pada, okay, we have different indications for the Shilajatu. Okay, but the text says, Naso asti rogo bhuvi sadhya rupa shilavayam yam na jayet prasaya. Text says if you want to prescribe the Shilajatu, most of the time this is the last drug of choice for most of the clinical conditions. But it's not so. It is indicated in wide variety of the clinical conditions. Just you see the particular indications, the prameha. Okay, most of the time it is indicated in kapha and meda conditions where there is an involvement of kapha and the medo dusti. Definitely we can go with the prescription of the Guru Rasayana. Best example, the prameha is one such clinical condition where the tridosha dosha dusti is seen. but the dominancy of kapha meda is common in most of the patients. And the Staule also, even Vata Rakta, if it is for occur in a patients of the Sukumara and more of kapha and the meda dushti and Rudroga. Okay, nowadays most of us are hearing means getting the cases of Rudroga, and we are getting many news related to the particular Rudroga cases. Definitely, okay, like the contemporary medications, what we have, the other medications like the ecosprin, and definitely it is acting in many of such patients where if you identify the kapha meda dushti and prescribe the classical dosage of the Guru Rasayana is having more than that defect. Definitely, you need to consider this part. Okay, definitely, it is indicated like the Pandu, Shonita Dushti, like the patients of the essential hypertension and Avarna Janya Vikaras. Many times, it is very difficult to identify the underlying the pathology cases of the Avarna. Okay, where you identified the Avarna pathology, there also the Shilajatu preparation, like the Guru Rasayana, definitely it is helpful. Not only the Guru Rasayana, we have Shivagutika and we have the Chandraprabha, the Vati also. Definitely we can go with that particular drug, but routinely here I am using the 12 capsule of the Guru Rasayana for a duration of 15 days. This particular 12 capsule early morning empty stomach is the best dosage for. Sometimes this particular dosage may produce the vibandha in a patient. We can divide because it is having the loha shilajatu as the ingredient. We can divide into 6 capsule or 4 capsule TID as the dosage form. But this particular rasayana prescription should avoid the vidahi, the consumption of vidahi, abhishanti and the kullata. What mentioned in the shilajatu, the rasayana, the same, the patya and apatya has to be followed while prescribing the guru, the sign. Here I had an elderly male patient, not a known case of DM and HT, was apparently normal 1 year back. He gradually started developing the appearing both the lower limb associated blackish discoloration. So this is a pure case of the Vata Rakta, and this particular patient was advised for the surgery. He just had a plan of the planning the Rasayana, the two, the Guru Rasayana. This Rasayana is prescribed in this particular patient as the Shamana dosage form for the period of 2 months. So this patient was saved from the surgery. That's my that much the multifactorial effects are possible if you properly plan the Rasayana medications. That's why always have an option to practice Rasayana along with your other medications also. Next. So,
Hello, sir.
is there any problems or network problem there?
No, sir. You can continue, sir.
Not changing actually. Okay. Next, the one more, the Rasayana which is routinely used, the Guduchi Rasayana. Okay, the most of the time this Guduchi Rasayana, okay, all of you know Guduchi comes to be the drug which is used in many of their clinical conditions. The main falashruti of the Guduchi Rasayana is the Jwara, Vatarakta, Prameha, Kamala, Pandu and the Akrimi. The dosage pattern of this particular rasayana is 12 capsule OD for a duration of 15 days. The Anupana is the Jala. It's also available in cellulose capsule form. The 12 capsule is the classical dosage. You can modulate either 2 TID or the 4 TID as the dosage form. Here I had a patient of the Lashuna Rasayana, sorry, the Guduchi Rasayana, which is prescribed for the pyrexia of the unknown origin. The patient came with the known case of already the fever which is diagnosed in an earlier hospital and not relieved with the particular the presentation. Just planned the Guduchi Rasayana for a period of 1 month. Okay, many times this is helpful in a Dhat where there is an involvement of the Dhatu, the Lina Dhatu Avasthas. Like this is like the Purana Jwara and this is like the Amavata. Definitely the Guduchi plays a very important role. This patient almost all right in the duration of 1 month. And next, this is also the very the important rasayana which is indicated in many of their clinical conditions like the estimado, the rasayana. The indications are the tamakaswasa, amlapitta, shita pitta, vatavadi, palakshaya, karsha, palita and kalitya. In my clinical practice, routinely I am using cases of the vatavadi, especially the dhatukshayajanya vatavedi like the kanja, pangu and kalaya kanja cases of grudrasi that were kevala vataja, the grudrasi. The duration of this particular rasayana will be the 30 days. First day you need to administer the 4 capsule, second day the 8 capsule, third day 12 capsule, and next the fourth day 16 capsule, and every day you need to in the same dosage. The fourth day dosage is followed up to the 30 days. This is the duration of the this yoga, this estimado, the rasayana, and the pacha will be the akshira. Here I had an interesting case. A boy aged about 12 years. Okay, a boy aged about 12 years. He came with the patchy hair loss. Okay, here you can appreciate the loss of the hair. Okay, what we call a case of Indralupta. And even he had the case of the loss of the hairs over the eyebrows. And he was having the intense itching. And here he was consulted in many hospitals and took many the antifungal and other the medications which are prescribed by the dermatologist, and there is no much improvements in the particular the symptoms. But he was consulted to me and just given a plan of the rasayanas, the combination of some the rasayanas. The one was because the Gandhaka Rasayana is one such prescription which is having the wide the applications. Okay, it is even though told for the Kushta conditions, but we can adopt the particular the Gandhaka Rasayana in many clinical conditions. But here the only rationality to select this particular the Rasayana, okay, the underlying the krimi may be the cause in this particular patient, and the estimado is one such the rasayana which is having given the kesha the effect. That's why this particular rasayana is prescribed as the oral dosage form as the 1 BD a dosage, and just the Tanika the applications by Ichabedi and Krimikuta rasa with Nimbus rasa. This medication prescribed for 2 months. Okay, and even it is surprising for me also. Okay, this much changes we can observe in this particular the patient, and later we continued just for a period of another 3 months the same medications. At present, patient is all right, and he left medications from last 2 years. Okay, that is the effect of many of the rasayana medications. Okay, that's why all of you think from today itself to take one the rasayana in a clinical practice. Okay, among any of these the rasayanas. Next, one more we have the bala or the balamula, the rasayana. It is purely the word itself, bala. It gives the bala to the many of the patients. That's why you need to select this particular the bala in the patients of the either dhatukshaya or the way balahani is observed. The best example is the pakshagata, grudrasi, shatakshina and karsha. The dosage pattern of this particular the balamula is 2 TID. It's available in the capsule form. The duration will be 1 month, and the pacha will be the kshira. Here I had a case related to the a male patient, sorry, the female patient aged about 40 years. She had the giddiness, okay, giddiness which is associated with the altered consciousness for some duration of the time. She consulted and done some of the investigations. There is no underlying cause for this particular the presentations, and just patient treated. So all of you know the Brahma is the Pitta and Anila, the Praya. Just given with the one course of the medications of the Rasayana, the only a Shamana dosage of the Rasayana which is prescribed, the 2 BD as the dosage form. The patient was all right, and she left the medication from the last the 5 months. And this is the Rasayana which is abundantly the used. Okay, that is the Lashuna, the Rasayana. Okay, here the reference, the basic reference of the Lashuna Rasayana is from the Ashtangardaya Rasayana Rogadikara. Okay, the text says the Lashuna pulpa is Kalkardia pulp which is considered a best method to administer. But the palatability wise, it is very difficult to go with the Lashuna, which is mentioned in the classical the format. That's why we have the dried and freeze powder of the Lashuna. Okay, where it, it follow the all the classical guidelines and the dosage form. The total duration of this rasayana will be the 16th day, and 17th day we need to go for the arachana as the modality. From first day to the fourth day, go for 12 capsule dosage form. From fifth to eighth day, the 24 capsule. Every day you need to increase their 12 capsule, and the third dosage form will be at 36, and from 13 to 16th day will be a 48 capsule. Totally it is a duration of the 16 days. Every 4 days you need to increase their 12 capsule. At the end it will be last 4 days the 48 capsule. See, most of you think that is it possible to consume these many the capsules? If patient is not willing to take that much capsule orally, definitely you need to modulate yourself. Just add those capsules to the kshira, okay, and it is dissolvable many times. The dissolved form of that particular kshira you can advise to the patients. And on 17th day, the text itself can give an clue. The rasayana like the lashuna is tikshna and ushna. Okay, many times there is a possibility of the pitta prakopa in a patient. On 17th day you go for the rechana by using any of the virechana dravyas. Commonly on 17th day we'll go for the sadhya virechana by using either chururut leha 10 to 20 grams or avipatikara churna around 10 to 15 grams. While prescribing the Lashana Rasayana, you should always try to avoid your patients like Atapa Sevana. Again, the Atapa Sevana may produce the Pitta Prakopa in a patient. Definitely, the Atapa Sevana, Tikshna, Ushnaharas are contraindicated in these patients. And Kshira and Shastika Shali is constituent Patya in these patients. Here, routinely I am using the Lakshana Rasayana in a case of Rudrasi. Okay, definitely it is having the very good result. Here, 20 years, 28 years male patient presented with the pain in the lower lumbar region. It was radiating to the right leg, and almost the classical presentations of the Kevala Vataja variety of the Rudrasi. Okay, here you can see about the spondylosis changes, and there is a lumbosacral junction sacralization. The patient just given with a course of Lashana Rasayana along with the Katti Basti, patient got the 80% result in a span of the 1 week. It definitely is possible if you follow the classical methodology of the Lashana. In this particular patient, we follow the pattern of 12, 24, 36, and 48, the dosage form. The patient was all right. Last day he was experienced just a burning sensation. The next day we planned for the Nitya because many times this is common. The person who belongs to the Pitta Prakriti or more of Pitta Dushti, so definitely there is a possibility of the Karapada Daha or Ura Daha in a patients of Lashana because the drug nature itself is constituent like that, and possibility of the Pitta Prakopa. There you can go with the administration of more of Kshira and the sitting of just a Sadhya Shodhana, that is also we can adopt. And last, the category of the Rasayana. Okay, what we discussed according to the different shrotas. Here, the one more, the particular, the practice from my side, the Manova shrotas. Definitely, okay, all of you know the Medhya is the one such drug which is indicated in many of the Manova shroto dushti vikaras like Unmada, Apasmara, Madatya, Chittodvega, Nidranasha, and even cases of the Madatya. Okay, many times the patients who disturbed with the monoshrotas, the combination of the shariri, the vikaras of the sharirika dosha dushti and manasika dosha dushti, both are existing in some patients. We can even look, there is a chance of or scope for the Medhya Rasayanas. The Brahmi is one such drug. We have Brahmi, Mandukaparni, Shankapushpa, and Estimudu. According to the severity and need, can go for the routine prescription of Medhya. Here, routinely we are using the Brahmi capsules 2 TID as the dosage for, and here there is no particular because some Rasayanas are having a specific duration of the administration. Some are mentioned till Vadi Shamana. Okay, Brahmi is such one such drug you can use till the Vadi Shamana, and Shira is the best, the Patya you need to follow, and better to avoid the Guru and Abhishandi Aharas in these the patients. All of you know this particular Manduka Parani is Constubena Shrestha, the Medya in many the clinical conditions. This is just a Palashruti of Medya, the Rasayana. Here I had a patient of the male patient was apparently normal 6 months back. Gradually started the multiple somatic complaints like the chest pain, difficulty in breathing, the palpitation, burning sensation in their chest is associated with sore belching and reduced appetite. Okay. And he done with many of the investigations like the echocardiography and even the ECG, all were within the normal limit. Patient prescribed with the contemporary, the anxiolytics like the petrol beta and metoprolol, and patient consumed these medication for the 1 month. There is no much changes when patient takes the medication. The time he was all right for few hours or few days, but later again after discontinuing the medication, the same thing is continued, and he consulted to me and diagnosed as a case of Chittodvega. There is involvement of definitely Manavashrotodusti, and prescribed just a course of the Medya Rasayana, the capsules of the Brahmi for a duration of 1 month, and patient got the 70 to 80% of the improvements just by the single Rasayana prescription. That's why what I want to highlight here, the Rasayana should be planned according to the different Avastas. Okay, these are the outcome, the action of the Rasayanas. All Rasayanas are considered to be having action on the Arasasya Ayanam. It starts from its action from the Rasadi Dhatus and nourishing property of the Rasa, and even having the action on different strotas, and some Rasayanas also having the action on the Dagni, and it always improves the quality of the dhatus, and the more or the desired outcome will be the Vayastapana and even the immunity and mental, the power of the individuals. From all these, we get the action of the rejuvenation. Okay. All of you take home points that Rasayana is a unique treatment modality. It is explained in Ayurveda. The selection of Rasayana Dravya depends on many factors. Already we discussed the Rasayana. Okay, suddenly, if anybody comes with any Abhigata or the Dhatukshaya, suddenly if you want to plan the Rasayana, it's not the thing. Always assess the underlying factor. What may be the cause for Dhatukshaya? For example, the patients of Vata Vyadhi also will have the Dhatukshaya, and even patients of the Ikshma and other, the Urakshata Kshina. There also there is a possibility of the Dhatukshaya. But the prescription of Aushadhi may be a different, or Rasayana dosage may be different. That's why all of you think that the underlying the factors for Rasayana prescription, and try to adopt the Rasayana as a treatment protocol in your routine clinical practice. It never give any of the adverse effect. Always give the good benefit to the patient, and you can well verse in the practice of Rasayana. Always along with your Shamana medication, try to add one prescription of any of these, the Rasayana Aushadhis. If Rasayana is practiced according to their classics, what I mentioned, according to their classical methods like the Shodhana followed by Samsarjana, then administration of the Rasayana Aushadhis as a classical methodology, and the Anupana and Patya which is stored in their classics, then definitely we can get the desired outcome. Otherwise, also will get the result, but there is a variations in the outcome. Definitely, it is possible. So better to possible. If 100% is not possible to follow their classics, at least we can follow 60 to 70%, which is mentioned in their classics. Then also will get the desired results by the Rasayana practice. With this, I end my presentation. Once again, I thank all the organizers for your the wonderful organizations, and I even thank all the participants for your the patience here. Thank you, one and all.
Thank you, sir. Thank you so much for the detailed explanation. Shall we go on to the question and answer session, sir?
Sure, sure.
Okay, sir. In the chat box, there are some questions. I'll take up the questions. Uh, Sir, can you please explain, is there any role of Anupana or Sahapana while giving Rasayana?
Yes, definitely. Okay, many rasayanas are prescribed with specific the anupanas also and even the patya also. Okay, definitely, it gives the added the benefit to the individuals. Okay, definitely, we need to advise the particular rasayana according to the individuals and the clinical condition. Then only we'll get the good results out of the rasayana practice. The
Okay,
best
sir.
example I
Uh,
repeatedly quote the Lashuna. While prescribing Lashuna, the best is the Kshira and Kshira Vodana, and always try to avoid the Amla Dravyas and Ushna Tikshna Aushadas. That is also the thing you need to keep in mind.
Sir, in Lakshana Rasayana, actually, when we think of Lakshana, it is Ushna Tikshna, so we think of like it is advised in Avarana Janya Sampraptis. But in the Falashruti, you told about Amla Pitta and some of the conditions which are like we think like might be the Prabhava here working here, but how do we explain that, sir?
Yeah, definitely. In some of the pitta conditions, if the Taratama Bhava is considered there, okay, more of the pitta dushti and rakta dushti, better to avoid the lashana. Okay, if alpa pitta, definitely we can go, but we can balance that particular the pitta by prescribing the anupana or the apatya. That definitely helps in a patient. Okay, not the more of pitta dushti. Okay, there you need to avoid. If more of the vata and alpa pitta, definitely we can advise the lashana as the choice.
Okay, sir. Next question. What is the dose of active phytochemicals in each capsules, especially the Lashana Rasayana? If it is 500 mg, then whether the dosing differs from person to person is the first question.
Yes. Yeah, definitely the dosage may vary according to the individuals. But if you want to know the phytochemical constitution of the Lashana drugs, there is an elaborative thesis which is done from STM. So definitely we can go with the www.aish research portal related to the Lashana Rasayana in Grudrasi in both classical dosage and Ardha Pramana of the Lashana dosage. Definitely we can visit and you can see for the some of the thesis which are done on the Lashana Rasayana from Department of Kaya Chikitsa.
Okay,
And
sir.
actually, which is available from SDM is 500 mg of each capsule, which is dried and freeze powder. Okay, you will even have the display of many of the rasayanas in SDM pharmacy website. There also you can search for that.
Okay, sir. In continuation, is there any relation between Madhu and Cushing's syndrome? If yes, how to decide the dose in pediatrics and adults separately? Role
What
of
sir?
Madhu. Maybe she is asking the role of Madhu in Cushing syndrome. If yes, how to decide the dose in pediatrics and adults separately?
Yeah, definitely. I don't have any such experience to treat the case of Cushing syndrome by using the Rasayan, this particular estimado. But estimado is commonly in my routine practice. I told already the Dhatuksha and in cases of Indralupta, Kalitya, Palitya, and the person who is Karsha, there we are using the particular estimado Rasayana. But in case of the Abala, it is very difficult to go with the classical dosage like the 4, 6, 8, 12, and the 16 dosage form. It's just the Shamana Rasayana dosage like one capsule BD. If patient, the individuals are more than 10 years, then only it is easy to prescribe the particular capsule form. Otherwise, we can modulate ourselves and we can go with the Churna or Kshirapaka form as the dosage.
Okay, sir. Next question. How to plan Rasayana in patient who are well nourished but has Palitya or Kalitya?
Yeah, definitely. This is a good question. The patients who are well nourished, you need to consider the rasayanas which are indicated in case of the particular the conditions of the kapha and the ameda. So definitely, first you need to bring the kapha and the ameda or the conditions like the sankarpana vikaras into the normalcy. Then only we can go for other rasayanas. Many times, you know already the person who is already in a particular the Santarpunata Vikara, their difficulty or the many times the diseases are itself a kruchra sadhe in nature. But in such conditions, one with the Rasayana which is having the Lekana property, the best I was quoting like Guru Rasayana. Along with those, the Rasayanas which are indicated We can use the rasayanas also to combine both the effects of the rasayana aushadis. Even we have the tuvaraka, okay, we have the bilva, okay, we have the other rasayanas like the particularly the asana, the asana rasayana or the bijaka rasayana, which are specifically told for the conditions like prameha, kusta. Okay, just go with the Shushruta's understanding about this particular rasayana like bijaka or asana rasayana. Definitely you get an idea how we can modulate the rasayana prescription according to the Santarpanota and Apatarpanota vikaras.
Okay, sir. Next question. For weight gain, which rasayana can be given, sir?
According to mine, already the advice Shinakshatanam is indicated like he is not Shinakshata, but to well nourish about the dhatus in a patient who are in Alpa Pramana, the one drug of choice will be the Estimadu. We can advise the Estimadu capsules or Estimadu Kshirapa to the patient. And before to that, the patient is feeling difficulty, we can even go with the 15 to 20 grams once or twice a day with Kshira.
Okay, sir. Next question. Sir, the duration which you said, like Chawnaprash, is it only for 1 month and to be stopped, or by giving gap, again rasayana should be started?
Yes, definitely. It purely depends on the condition. Okay, sometimes the dhatu kshaya or the kshata kshina avastha will be a more, and patient is causing a more of problem to the patient. There is no limitation for the some of the rasayanas. Till the vyadhi, we can use the rasayana aushadis, or sometimes we can restrict ourselves till the 1 month or 2 months or 3 months. Okay, some rasayanas are specific in their duration. Okay, we have Arogya Vardhini for one mandala, we have the Lashuna for the period of 17 days. Like that, later we can modulate their dosage into the Shamana form of the rasayana. If it is the classical dosage you followed earlier, just maintain that particular the rasayana in a Shamana medication format, like 1 capsule, 2 capsule, or 3 capsules, or the layers in the form of 1 teaspoon or 2 teaspoons. That is the best method we can follow when later days of the Rasayana practice also.
Sir, there is a common practice in household that they use Chawnaprash even by the healthy people. So, is
Yes.
it advisable to use it daily for healthy people?
Yeah, definitely. It means if you want to practice classically, definitely you need to consider practice, but people don't know. Okay, that's why I added one more name, and it is sold by STM, because common people should not know some of the prescriptions like the rasayan. They are go on taking without knowing the proper properties or the dravya of the content of those medications. Definitely, it may be harm in some of the patients, and some of the pharmacies are widely the selling those drugs without a prescription of any of the consult. That's why we can modulate, and we should change the name in the form of the Bhargava Prokta Rasayana to keep some of the hide and secrecy with you. Okay, if you are giving like Chavanaprasha to those patients, definitely most of will sell, and many will give without knowing the knowledge of those medications. Definitely better to avoid that.
Sir. Which rasayana can be used in skin diseases?
We have Kadira Sara Rasayana, we have Asana Rasayana, and we have Arogya Vardhini, the Rasayana. Okay, according to your availability, definitely we can choose. Okay, text says the scope for the Arogya Vardhini, Kadira Sara Rasayana, and when the Tuvaraka Rasayana. If you want to get because many times the conditions of the Kushta, okay, they are Bahudosha Avastha. Many times we need their Shodhana action. Okay, better to plan the Tuvaraka Rasayana available in the form of the Tuvaraka Taila. The main outcome in case of the Tuvaraka Rasayana will be is definitely having the Shodhana, the property there, the Dosha Shamana, the Dosha Nirvana, even possible from the Rasayana medications. There rather than Shamana medications, sorry, Shamana Rasayana go for Shodhana Rasayanas like the Tuvaraka. Then you can shift your prescription to the Kadira or the Avalguja Rasayana also. Okay, there also we have specification. Avalguja is more specific to the Aswitra, and the Kadirasara is indicated in almost all the particular Mahakushta and the Akshudra Kushtas. Okay, according to your needs, you can select.
Okay, sir. Next question. In case of Shweta Pradara, what is the dosage pattern for Amalaki Rasayana and which and all other rasayanas are used in this case, sir?
Definitely in Sweta Pradara, there is a scope for the Guru Rasayana. Usually, you can use their 2 TID dosage form, and Amalaki Rasayana usually the 2 to 6 grams once or twice a day. Okay, that is also helpful in cases of Shweta Pradara. Okay, here we are using the 2 TID of this particular the Guru Rasayana or the Silajatu Loha Rasayana.
Okay, sir. There was one more question regarding Lashana Rasayana in Amlapita that you have already answered. I will take the next question. What about Rasayana in post-operative cases, sir?
Yeah, definitely. I told many times the patients of any of the surgical procedures, if it is a major surgery, okay, there is a high chance of the dhatu involvement again. Okay, most of the time, either dhatu kshaya or the dhatu pramana is lost. To fulfill that, many times, considering the avadi and dosha avastha, okay, we have wide scope to prescribe the rasayana. Okay, commonly, okay, the rasayana which is indicated in many of the clinical conditions like the Bhargava Prokta Rasayana as the best, the Balya and the Brahmana. The next to that we have the Kushmanda Rasayana. Okay, next we have the Estimada Rasayana. Definitely you can use in many of the post-surgical cases as a Rasayana as a prime modality. And even we can take many research protocol in many of the clinical conditions, the post-operative management by Rasayana. Okay, definitely we can do that.
Okay, sir. Pandu is one of the indication in Shilajatu Rasayana. Can you explain in which type of Pandu, sir?
Definitely, here the classical dosage what I mentioned is very difficult to the follow in our cases of the Apando. We can go with the Shamana dosage form. Okay, there indicated rasayanas will be the Loha, the Rasayana, and next will be the particular the Yoga Raja, the Rasayana, which is indicated in Mandura, the Vataka. Along with that, the particular the Chavana Prasha. There also we can adopt as the combined the effect of the different Rasayana medications. What I mentioned, the Guru Rasana is very difficult to plan in all the cases of Pandu. Some patients we can plan more of the Kapha involved cases. Definitely it is helpful. And in such cases, definitely the Agni, because the Sarva Dhatu Sikilata is the common thing which is observed in the cases of Pandu. Considering that we should select for the different Rasayana Aushadis. Commonly we'll go for the Yoga Raja or Dhatri Loha as the best drug of choice rather than the lower preparation initial days of the Pandu cases and more
Okay,
of
sir.
the
Especially, next question, especially post hysterectomy, female complaints of debility and also loss of interest, as well. So, which one will be good in this condition? Post
Shatavari.
hysterectomy.
Shatavari is the best drug of choice. Okay, there even we can refer the Palashruti which is mentioned in Kashyapa. Okay, we have different kalpas like Shatavari kalpa, Lashana kalpa. According to the best choice of drug will be the Shatavari. You can use the Shatavari granules or you can use the Shatavari Kshirapaka. Definitely it is helpful in post-operative hysterectomy cases.
Okay, sir. Is Rasayana helpful in pregnancy? If yes, then which Rasayana can be given, sir?
Usually, the rasayana which is indicated in pregnancies, one is the Chavana Prasha, is also indicated, and next is the Shatavari. So these three rasayanas are commonly prescribed, but my area of interest not to use this because I am the person belongs to the Kaya Chikitsa. I don't prescribe many of the rasayana aushadis in my protocol, but other the person who is well versed in the prasuti and stri roga definitely they can go these rasayanas. There is no contraindication for these rasayanas in pregnancy. Okay, but the difficulty to plan with rasayana dosage form, we can minimize the dosage in these cases.
Sir, can you repeat Chavanapura, Shatavari, and one more?
Esteem of the rasayana. These are
Okay,
available
sir.
in capsule and the Pushmanda is also used in many of their patients of pregnancy or the more of the lean and all. Okay, the Karsha is the feature which is seen.
Sir. Can Bhargav Prokta Rasayana given with milk? can be given with milk.
Yeah, definitely, but it should not be mixed with milk. After the 2 or 3 teaspoon of the intake of the Bhargav Prokta Rasayana, after a gap of 10 or 15 minutes, you need to advise the individual to take the few or at least 100 or the 150 ml of milk. Definitely, it is helpful. Okay. Many times, the Rasayana Aushadhis are not properly mixed with the milk. That's why.
Okay, sir. What protocol do you follow in practice for Sadhya Shodhana before Rasayana, sir?
The course of the Rechana in a patients of the Vata Pitta Dushti, that is by using 15 to 20 grams of Tirurutleha on the day of admission, and sometimes we'll go for the Gandharvastadi Erenda 15 to 20 ml, and next day directly we'll start with the Rasayana. If more of kapha dominant patient fit for the Sadhyavamana, we'll go for Sadhyavamana by using the 2 liters of St. Madhu Quanta and 1 gram of the Madanapala Pippali Churna and 500 milligram of the Vacha and Sando.
Okay, sir. Which Rasayana will be helpful for immunomodulation, like in autoimmune diseases?
Already I discussed in elaborative about the Rasayana, the outcome. The Rasayana, almost all the Rasayanas are having a good the effect in many of the clinical conditions. But in routine practice, the best immunomodulator and routinely used is the one is the Chavanaprasha, and next to that will be the Kushmanda, and next will be the Shatavari, and some of the proprietary Rasayanas which are mentioned, like the Swamla compound, definitely is helpful in many of their clinical conditions.
Okay, sir. Other than Pippali Vardhamana Rasayana, which Rasayana can be used for Amavata? And if patient is of Pitta Prakriti, which Rasayana is ideal, sir?
Usually I use for the Guduchi Rasayana. Guduchi, the 2 TID dosage, definitely it is helpful. And next some may be the Madhusnehi Rasayana. There also that is Ushna and Tikshna Dravya. There also you need to take care. But we can balance from the Anupan.
Okay, sir. Liver disease, which Rasayana can be given, sir?
One is the Guru Rasayana, and another one is the Arogyavardhini, the Rasayana. In routinely, in many of the cases of especially the Kumbha Kamala and Kamala, where there is the standard protocol of the Arogyavardhini Rasa 2 TID or 4 TID as their dosage form. Okay, many times it is having very good result, and we have many evidences pertaining to the cases of the Udara. We can visit to the YouTube channel. You can definitely see about those the results.
Okay, sir. Which Rasayana is best for type 2 diabetes?
Already better not to correlate with any of the clinical conditions from contemporary understanding what the classical methodology is toward for diagnosis of the disease. We definitely use that. The patients may be suffering with more of kapha or pitta or any variety of the prameha. It comes under prameha itself, but you select the rasayana which is mentioned in prameha. Okay, we discuss list of rasayanas which are indicated in prameha. Okay, one is the Guru Rasayana, another one is the Chandra Prabha, another one will be the Shiva Gutika, and next in Shushruta's version we have the prescription of the Asana Bija Rasayana, and next we have the Vidanga Tandula Rasayana. Here we have many such the drugs for selection of the Rasayana Aushadhis for Prameha condition. But very good, the Prameha Ragna or the Prameha, the Rasayana will be the Shiva Gutika and the Guru Rasayana. Definitely we can use the 2 TID dosage of Shiva Gutika and either the Guru Rasayana 4 TID or 2 BD dosage. Duration of at least 1.5 to 3 months, and you can take the values of the blood sugar level, the HbA1c, FBS, PPBS, and we can compare about the available the laboratory investigations. Okay, many times by prescription of these particular the Guru Rasayan and Shiva Gutinaka, many the Prameha patients are left the prescription of insulin and even they wandered. Okay, definitely This is helpful. You can even practice in your clinical practice.
Sir, whether Chyawanprash is to be avoided in Pramini, sir.
Yeah, nowadays I already told the many modulations are possible. If we have sugar-free and sugar-free preparations, definitely sugar-free we can use in such conditions. And nowadays the many pharmacies are mainly the Chyawanprash capsules also, and even Chyawanprash tablet also. Definitely we can modulate that particular form because many times the Gouda preparation may increase the blood sugar level in a patient. That is also a possibility. You can modulate that also. The Dabur is preparing many, not only this.
Okay, sir. Which Rasayana to choose in post-viral fever or post-viral arthritis?
The Guduchi Rasayan. Guduchi is the best drug of choice. The 2 TID is the dosage format. I already discussed one case of the post-viral infection and finally diagnosed as the pyrexia of unknown origin and treated with the Guduchi Rasayan.
Okay, sir. Which Rasayana can be used in optic neuritis?
I'm not the person of the Shalakya. I'm well versed in that particular practice. Then only I can tell. But one of my teacher given the prescription of the Guru Rasayana in some of their cases, it's very difficult to conclude based on single patient. It is having very good result. But according to the dosha avastha, you can select any among these particular Rasayana. Some patient may be possible with the Nagabala or the Balamula. According to that, you select and we can well verse the practice of Rasayana even in the cases of Shalakya also. But according to my knowledge, the triple I is considered to be best in case of Akshya Amayeshu. That also we can use in such patients.
Okay, sir. Next, which Rasayana will be useful in vitamin D deficiency?
Vitamin D deficiency. I already told myself personally, I am not dealing with any of these. I am not interested to correlate any of the Vadi Namakarna and the contemporary understanding from Ayurveda treatment protocol. You can use any of the Rasayana which is prepared for the especially the Vatavadi conditions. Again, the best drug will be a Bhargava Prokta with Kshira, Estimadu with Kshira, or Balamula with Kshira. These are the available the medications. But how much it is acting on vitamin D3 and deficiency, again, you may need a further clarification. Sometimes, if you want to really become a good evidence-based practitioner in Ayurveda, take the patients of the vitamin D3 deficiency are with you, take before treatment value and after treatment value, and try among any of these rasayanas. Then we can conclude this particular rasayana may be having action on this particular vitamin deficiency. That also we can do.
Okay, sir. Uh, in hypothyroidism with the lean build, which type of Rasayana we can advise?
Third, that indicative of again the vata, if the person who is lean or their karsha, the better option will be again the vatahara rasayanas. Definitely the combination of the particular the bala that is helpful in some of the cases, but the patients of the obese, the hypothyroid and getting more the combination of the guru rasayana and the shimula katutra are working well in such patients. In Karsha patients, the combination of the particular the Nagabala and Ashtimadu, that is having the very good the results. That also you can try.
Okay, sir. In case of Ashmari, UTI and UTI, comma UTI, sorry, if patient once cured and if there is chances of recurrence, which Rasayana to choose?
You know, the Agra in case of the particular the Basti, Shila Basti Jeshu Girijam, we have the Rasayana, the Agra from the Ashtangar there, the Basti Jeshu Girijam refers to the Shilajatu preparation. Okay. Any Shilajatu preparations we can use in any of the urogenital disorders like Chandraprabha, Shivagutika, definitely it is helpful and Guru Rasayana also in my routine practice where there is an involvement of basti. Okay, definitely the Shilajatu preparations like Chandraprabha, Shivagutika, going giving very good result, definitely we can plan that dose the Rasayana Aushadhis.
Okay, sir. There is one more question related to Shalakya. That is myopia. In which rasayana in myopia?
No, I don't
Oh,
have any idea at present. Okay, in further, if I get such patient, definitely I can guide you about the Rasayana Prayoga in myopia.
okay, sir. Next question. Rasayana which we can opt to lose weight in obese. I think you have told with respect to Guru Rasayana, I have answered that
Yes,
question.
yes.
Okay, next one. In cholecystitis, which rasayana can be given, sir?
Definitely again the Shilajatu, Lake best, the Lekana, the Ravyas, definitely the Shiva Gupika, Guru Rasayana is best.
Uh, sir, rasayana for cardiac issues.
You already
That also
told
you
the
have answered. Yeah.
okay, okay. In Vidishwanitya chapter, there is a lot of scope for the usage of the Shilajatu. The Shilajatu is considered to be the best drug for the Shonita Dusti. Okay, what the Rudroga is mentioned in the classics. Almost all the patients will have the problem of the Damani, the Upalepa, and the Shronita Dusti. Definitely, the Shiva Gutika is helpful, and myself done the thesis on the role of the Shiva Gutika in case of the essential hypertension. We come across very good result without any the patients of the contemporary the medications. Definitely, we can visit and see for the results of the Shiva Gutika.
Okay, sir. Sir, any experience in using Ballataka rasayana, sir? As Ballataka rasayana?
No, so I am not using any of the Balatika preparations.
Okay, sir. Sir, Narasimha rasayana?
No, myself is not restricted to these many. Okay.
Okay, sir. Okay, sir. I think that's all with the question and answer. If anyone is left out, you can raise your hand, unmute yourself, and you can ask the question, or else we can go for the vote of thanks. I think there are no more questions. Thank you, sir. Thank you for patiently answering all the questions from our audience and explaining in detail regarding the practical usage of rasayanas. We were just reading while reading for the exams. We are going through this rasayana padas, even vajikarana pada, and just we're not properly knowing how it is used as a rasayana in practice. So we have practically have demonstrated how it can be useful with the like properly with the dose and the duration in specific to the point you have explained. Thank you so much, sir. Now over to Dr. Srishail for vote of thanks.
Good evening, everyone. Especially thank you so much, sir, for explaining in detail about the Rasayana. Last 2 to 3 months, I requested you to sir. In between the busy schedule, sir had given the time with us. Thank you so much, sir. And thank you, others, for managing the session. And thank you, all the participants, for the attending. Thank you, one and all.
Thank you once again.